Hi, my name is Dr. Solmaz Nazmi, and I am a board-certified internal medicine physician and lifestyle medicine specialist practicing outside of Boston, Massachusetts. Today I wanted to talk to you about COVID-19 and management of mild symptoms at home and how to recognize if the symptoms are progressing into something more severe when you would need to actually go into the hospital. Also, I wanted to talk to you about when you can come out of self-isolation if you were directed to do so by a healthcare professional. So the thing with COVID that makes it so challenging is that the symptoms are so wide-ranging. So most people have very mild symptoms or no symptoms at all. So they might never seek any medical attention. They might not even know that they had it. So they could just recover without talking to a doctor, without ever seeing a doctor. So this probably means that the number of cases are much, much greater than what we're actually seeing because people are not really getting tested. So in other patients, in a smaller percentage of patients, the disease can progress into a much more severe illness and can at times also be fatal. So COVID symptoms develop within 2 to 14 days after becoming infected with the virus, and the median time is about 5 days. So about 81% of those who are confirmed with COVID experience mild to moderate symptoms. So when we talk about these symptoms, we're really looking at fevers, chills, cough, fatigue, mild shortness of breath, headaches, sore throats, and sometimes patients are presenting with anosmia or loss of smell. Sometimes patients are presenting with gastrointestinal complaints like diarrhea. So the things that we are recommending for our patients who have these symptoms, first of all, if you have these symptoms, call your doctor. Don't just proceed to the emergency department to seek out care, but call your doctor. And then they'll direct you on if you need to have testing or not. The therapies that we're recommending for our patients are supportive therapies. So we're recommending things like Tylenol to reduce the fever. We're recommending things like albuterol inhalers, which are basically we use them to treat asthmatic patients, but what they're doing to help our COVID patients who are having mild respiratory symptoms like mild shortness of breath or mild cough, it's helping open up the airways and improve oxygenation, and it's helping with their symptoms. When I wanted to go back to the Tylenol, the maximum amount of Tylenol that you can take in a 24-hour period is 4 grams. I'm more conservative with my patients, so I tell them not to take more than 3 grams of Tylenol in a 24-hour period. This is important to note because if you're taking other over-the-counter cold and flu remedies, sometimes they have acetaminophen in them or Tylenol, so you want to be cognizant of that, not to go over the 3 grams in 24-hour limit. When you're taking these sort of supportive treatments. The other thing that's really important is to stay very, very well hydrated, keep drinking fluids, keep on top of your hydration, and to get plenty of rest. Anecdotally, we are seeing some deterioration in patients who are taking the non-steroidal anti-inflammatory medications to manage their symptoms. This is medications like Advil, like Motrin, like Aleve. So my recommendation to my patients is to stay away from the non-steroidal anti-inflammatories for reducing fever, for body aches. Take the Tylenol. It's a safer bet. So now the other thing I wanted to talk about is that most people, so like about 81% of patients are having these no symptoms or mild to moderate symptoms. 14% of patients are going to develop more severe symptoms. So they might have more severe shortness of breath, which could be a sign of pneumonia. And the median time that we're seeing this in, the symptom progression, is 5 to 8 days after the symptoms begin. So you definitely want to seek medical attention if you're having persistent fevers, if you're having trouble breathing, if you're noting any sort of extreme fatigue, sleepiness, confusion. Also, if you're noting any sort of color changes in your lips or in your face or in your skin, if they're turning sort of bluish in color. If you're having any pain or pressure in the chest, these are signs that you definitely want to call your doctor ASAP and find out what the next steps are if you need to go into the hospital. I wanted to also talk to you about self-isolation. So if you do have symptoms of COVID, or if you have tested positive, it's important to isolate into one room in your house, and if possible, use one bathroom for yourself, and to wear a mask while you're in your house to avoid transmitting the virus to other members of your household. So when can you come out of self-isolation? There are 3 scenarios under which you can come out of self-isolation. You can come out at least 7 days after your symptoms have started. You have to have no fever for 3 days without the use of antipyretics. So that means that you have to be fever-free without the use of Tylenol or any medications that can lower the fever. And also you have to see improvement of your respiratory symptoms. So those 3 things have to be met before you can come out of isolation, self-isolation. So I hope that this video helped clarify a few points of confusion or concern. I hope that you all continue to stay well and continue to stay healthy. Take care.